Having rheumatoid arthritis increases the risk of family members developing rheumatoid arthritis. So a family member is 4 times more likely to develop rheumatoid arthritis than someone who doesn't have RA in their family. And that's a big concern for patients. So they are worried about this issue of the fact that their rheumatoid arthritis puts their children, for example, their siblings at risk of having rheumatoid arthritis. And one thing that patients are very keen on is this area of research which aims to try and prevent people from developing rheumatoid arthritis in the first place. It's useful for the researchers to engage actively with people with the lived experience of the disease that they're interested in. And that's particularly the case actually for some of the non-clinical researchers in the consortium who don't necessarily have direct access to patients with rheumatoid arthritis. So for them to understand what is important to people with rheumatoid arthritis and what people with rheumatoid arthritis have to live with, I think gives them huge insights into really the reasons for why they're doing the research that they're doing. And in fact, patient research partners themselves at a personal level have directly benefited. Many of the patient research partners within EuroTEAM have told us how valuable they found the experience of being involved with the EuroTEAM project, and how as a result they really feel they're making an important contribution to a research goal which they actually feel very passionate about themselves. As a group in Birmingham, we've worked very closely with patient research partners in many of our research projects, and they help us at a number of levels. So firstly, they can actually help set priorities for research. Secondly, they can help design research studies. And thirdly, they can help in the dissemination of the findings of the research. And within EuroTEAM, our patient research partners, who actually come from many countries around Europe, are involved in all 3 of those areas. One of the things that happens within EuroTEAM is that people at risk of rheumatoid arthritis are exposed to a number of predictive testing strategies, including taking blood for genetic testing or taking tissue from the joint or the lymph node or other regions. And actually one of the things that we really want to address is how acceptable these testing strategies are to patients. And patient research partners within EuroTEAM have helped us by designing questionnaires and surveys which we can use with patients undergoing these tests to see what they feel about them and how acceptable they feel they are. So one of the things that many patients actually ask me is, what is the increased risk of my children having rheumatoid arthritis, and is there anything that they can do to prevent the disease from happening? And those kinds of questions are really central to what EuroTEAM is trying to address. It's trying to develop predictors of the development of rheumatoid in people who don't yet have it, but may be at risk, for example, because of a family history, with a view to then developing treatments and lifestyle modifications which will allow the risk of rheumatoid arthritis to be reduced in the future.